Aslam Wilquim, Vewas AJ Joe topic hai. Actim 5 mg, bisoprolol fumarat. Benefits and side effects. Benefits of bisoprolol fumarat 5 mg. Bisoprolol is a beta blocker that primarily affects the heart and circulation. It is used for hypertension, high blood pressure, helps reduce blood pressure and the risk of stroke or heart attack. Heart failure, improves heart function and reduces symptoms like shortness of breath and swelling. Angina, chest pain, lowers heart rate and demand. For oxygen, reducing angina attacks, arrhythmias, irregular heartbeat. Helps control heart rhythm abnormalities. Post-heart attack recovery. Aids in preventing further heart complications. Migraine prevention, occasionally used off-label to reduce migraine frequency. Anxiety and stress symptoms. May help with physical symptoms like rapid heartbeat. Side effects of bisoprolol, 5 mg. Common side effects, mild and usually temporary. Fatigue or tiredness, slow heartbeat, bradycardia. Dizziness or lightheadedness, cold hands and feet, headache, nausea. Or upset stomach, low blood pressure. Hypertension. Serious side effects. Seek medical attention if experienced. Severe bradycardia, very slow heart rate. Can cause fainting or extreme dizziness. Worsening heart failure. If symptoms like swelling in legs, severe shortness of breath, or rapid weight gain occur. Severe drop in blood pressure can cause fainting or confusion. Bronchospasm, wheezing, shortness of breath. More common in people with asthma or COPD. Depression or mood changes, may cause mood swings or depressive symptoms. Hallucinations or confusion, rare but possible in some individuals. Allergic reactions, rash, itching, swelling, or difficulty breathing. Precautions and warnings: do not stop suddenly. Stopping bisoprolol abruptly can cause rebound high blood pressure or worsen heart conditions. Use cautiously in diabetics. It can mask symptoms of low blood sugar, asthma, or COPD patients. May worsen breathing issues. Consult a doctor. Pregnancy and breastfeeding. Use only if prescribed by a doctor. Liver or kidney disease. Dosage adjustments may be necessary. Would you like additional details on dosage, interactions, or specific conditions? Eiga app Mary channel. Pino Hein Mary channel Shavika Medicine. KO subscribe Kreen or like Karin.